Hello and welcome to the third in a series of 4 videos on managing your chronic obstructive pulmonary disease, or COPD. My name is Susan Nilsson and I have been a registered respiratory therapist for over 20 years. I have seen patients in all different stages of COPD, and I have seen what a difference it can make in their quality of life when they are educated about their disease and how it can best be managed. I would like to start off this video talking about pulmonary rehabilitation and managing your COPD exacerbations, and then discuss the importance of good nutrition for COPD patients. According to the American Thoracic Society, pulmonary rehabilitation, or pulmonary rehab, is an evidence-based, multidisciplinary, and comprehensive intervention for patients with chronic respiratory diseases who are symptomatic and often have decreased daily life activities. What this means is that we provide pulmonary rehab to patients who are having symptoms of COPD that are making it hard for you to do your normal activities, such as walking the dog or cleaning the house. Pulmonary rehab is performed by different healthcare personnel, such as doctors, respiratory therapists, dietitians, exercise therapists, and social workers. They all work together to treat the whole person and all of your needs, not just focusing on exercise. Some sample goals that many patients have when they begin pulmonary rehab are things such as being able to breathe easier, to be more active, to be able to travel, to have fewer hospitalizations, to go to a movie, to be able to take a shower, clean their house, or cook, and to be able to play golf again. These are all wonderful goals that are possible when you learn how to manage your COPD during pulmonary rehab. Some of the goals of the pulmonary rehab program are to develop an individual treatment plan for each patient. This plan is designed to help you increase your strength and ability to exercise. It is also designed to help you better control your symptoms, increase your quality of life, and decrease your anxiety and depression. This is done through patient education in areas such as nutrition, exercise techniques, managing your symptoms, and breathing techniques. One of these breathing techniques is showing patients how to do pursed lip breathing when they are having a difficult time catching their breath. You do pursed lip breathing by taking a deep breath in through your nose and blowing out through pursed lips like this. This is a very effective technique when you are getting short of breath to help you relax and get your breath back. There are many benefits of a pulmonary rehab program. You can see a decrease in your COPD symptoms, an increase in your ability to exercise, an increase in understanding your COPD disease, an increase in your ability to do daily activities such as showering and cooking, and a decrease in your hospitalizations. These benefits are possible with the help of a team of healthcare professionals working with you. We will go over 2 of the areas they will focus on during the patient education process. The first area pulmonary rehab focuses on is how to manage your COPD exacerbations. An exacerbation is a worsening or flare-up of your COPD. These often lead to patients having to go to the emergency room and possibly being admitted to the hospital. One of the goals of pulmonary rehab is to help patients try to decrease these flare-ups so they can spend more time at home and out of the doctor's office or hospital. Early signs of a COPD exacerbation or flare-up include increased shortness of breath, changes in your sputum or mucus such as increased amounts or a change in color, increased cough, and breathing faster. You may also notice that your heart is beating faster, you have a fever, or you are confused. When you start having these symptoms, you need to go to the doctor, urgent care, or the emergency room to receive care. The job of pulmonary rehab is to help you better control your COPD and symptoms so you don't have these exacerbations or flare-ups as often. This is done by educating you about your COPD, your different medications, when to contact your doctor, and how to stay as healthy as possible to help prevent your symptoms from getting worse and leading to an exacerbation or flare-up. The Centers for Disease Control and Prevention state that the majority of patients hospitalized with a COPD exacerbation are readmitted to the hospital within 1 year. Pulmonary rehab works to keep you from having that initial exacerbation or flare-up that causes you to be admitted to the hospital, which increases your risk of going back into the hospital over the next year. The second area pulmonary rehab focuses on is good nutrition. These classes help you learn how to eat in a way that is best for COPD patients. Malnutrition, which occurs when your body doesn't get enough of the food that it needs, is present in at least 1/3 of moderate or severe cases of COPD. This can lead to being unable to exercise or do the things that you enjoy and can make your COPD symptoms worse. There are several different ways that you could get the foods you need and help you breathe easier while you're eating. You want to make sure that you eat foods from each of the different food groups to get all the nutrients that you need. You want to limit carbonated drinks such as soda and overeating because it can crowd the lungs and make it harder to breathe. You want to limit foods causing gas formation such as raw apples, cauliflower, cabbage, cucumbers, broccoli, Brussels sprouts, melons, and beans. Limit caffeine such as too much coffee because it can make some COPD medications not work as well. You want to choose foods that are easy to make so you aren't too worn out to eat. You want to drink lots of water to keep your mucus thin. Adults should have 6 to 8 8-ounce glasses of non-caffeinated beverages a day. Reduce refined carbs such as white flour, pasta, white rice, and replace them with whole grains such as whole wheat bread. These things will help you get the nutrition you need to stay as healthy as possible while helping you breathe a little easier. Thank you for watching the third video in our series on managing your COPD. Please be sure to watch all 4 videos in the series. Here are some resources for finding more information on what was discussed in this video.